So, hi, my name's Elle and I'm a graduate of the Master of Genomics and Health at the University of Melbourne. What I enjoyed about the course was the diverse range of subjects such as clinical genomics, variant curation and counselling, and the ability to choose electives to tailor to your career interests. So in my case, this was project management electives. Being a part of the Melbourne Children's Campus based at the Royal Children's Hospital meant that we had exposure to seminars and network opportunities with leaders in the field of genomics, based at the Victorian Clinical Genetics Service and the Murdoch Children's Research Institute. So the Master of Genomics and Health course allowed for some great hands-on learning through internships and a research project. My first internship was with the Genomics and Health technology team at the Department of Health and Human Services, where I was updating the genomic content for the Better Health channel. And my second internship was at the Cancer Council Victoria, where I worked on educational material in genomics for patients and GPs. Both were extremely valuable internships that helped develop my skills and knowledge of genomics education and policy. I also undertook a mixed method research project where I surveyed healthcare interpreters and individuals from culturally and linguistically diverse backgrounds about the communication of genomic information and suggestions for best practice. So since I graduated, I have been working for the last 2 years as the clinical research coordinator for the White Matter Disorders Clinic at the Royal Children's Hospital and the Massimo's Mission leukodystrophy program at the Murdoch Children's Research Institute. Leukodystrophy is an umbrella term for a group of genetic conditions that affect the white matter of the brain. They are often progressive and fatal, with limited, if any, treatment options. And our program aims to improve diagnoses for these individuals and translate our research into treatments. In my role, I coordinate our patient clinic and research program, which involves a patient registry and genomic testing. If a patient remains undiagnosed after clinical genomic testing, we triage them into our research program where we do further tests such as RNA sequencing, long-read sequencing and proteomics, or we provide variant curation or reanalysis of the existing genomic data to try to find novel genes or disease associations to help find a diagnosis for the patient. I'm also coordinating a clinical trial starting at our site next year that uses antisense oligonucleotide therapy to help improve the symptoms associated with the type of leukodystrophy called Alexander disease. So my role is very diverse, and there are lots of diverse roles in genomics that the course could lead you to. So my advice for future students would be to research and find out what interests you and then choose your electives to help complement your career goals. Thanks for listening.